Jack Morgado, thank you for the super chat. Hi, Dr. C. Female, 43 years old, carnivore, 18 months. Lots of fatty meat and eggs. 7 weeks pregnant, perfect health. Third pregnancy, concerned about folic acid. Should I supplement? Any advice on exercise, food, vitamins, etc.? Thanks. Yeah, well, I mean, you can always check, right? And liver is really important, really, for pregnant women and breastfeeding mothers, and even early, early eaters. So kids eating their first sort of foods, you should try to include liver or even raw liver, as long as it's not contaminated or anything like that. So, 44% of women have MTHFR, right? And that means that they're not going to be able to methylate their B vitamins like folate properly. And so you're going to need more. And so that typically comes from liver. So you need to add some liver. And that's again, 44%, I mean, that's like 50-50 basically, right? So you have a 1 in 2 chance, or 1 in 2 women nearly will have that gene mutation. So you'll need that. Folic acid is a bit weird because it's not exactly the kind that we need. But at the same time, you can certainly take supplements if you're concerned about this. Typically, you need a lot of folate leading up to pregnancy. You need to be flush with folate, months before leading into conception, to make sure that you're not getting any sort of neural tube defects. So, but certainly now is a good time to add in liver. If you do check your folate and it is low on the low side, you need to check your erythrocyte level of folate. So the amount of folate that's in your red blood cells, or like RBC folate. Not every lab will do that, but that's the most accurate way of testing folate. It's not very accurate to test your serum levels because it works inside the cell. But the serum levels don't always translate to what's inside the cell. So that's why you want to check the erythrocyte level. Well, how much is in the red blood cells themselves? So try to find a lab that does that. And if you are on the low end of that, then certainly you can add in liver. That's important. Even just a couple ounces a day is more than enough. A couple bites of liver. So even if you don't bite liver, I mean, it's a couple bites. It's not going to kill you. And it is very, very good for you. And so, or you can also get the methylated folate, so like methylfolate. And there are supplement companies that will sell that, and it's not just folic acid. So you can just try that too. Just cover your bases, but you can just check. You just add in liver. I would probably do both. Just add in the liver, just cover your bases, and there are a lot of really good nutrients there anyway. Exercise, just normal exercise, it's actually pretty good. My grandmother on my father's side, he was her first pregnancy, and she just kept playing tennis and being active, to the extent that she didn't even really show all that much. And her friend, when she had a baby, her friends were thought it was some sort of adoption scandal or something like that. And because they're like, "Oh, you weren't pregnant. You didn't look pregnant." She's like, "I was absolutely pregnant. I've been pregnant for 9 months." And my dad looks, exactly like his dad and all his brothers. So there's no question there. But so yeah, you can exercise. Obviously don't overexert yourself. But you can definitely still exercise. It is good for you. It's good for the pregnancy and the baby, as long as you don't overexert yourself. Supplements, just good diet, and add in liver if you want it. And that's pretty much it. Yeah, I would just, you've been carnivore for 18 months, keep going, and just make sure you include liver, and you'll do great. So good luck with that.